Today's webinar will cover why data matching issues occur, how to help people complete documentation requirements related to data matching issues, and how to prevent data matching issues from occurring. Today's presenters here at the Center on Budget and Policy Priorities are Shelby Gonzales, Vice President for Immigration Policy, and Tara Straw, Director of Health Insurance and Marketplace Policy. Now I'll turn it over to Shelby to get us started.
Thanks so much, Ina, and hello, everyone. So in the marketplace and in Medicaid applications, people provide lots of information that is used to determine eligibility for enrollment, and to the extent someone is also applying for financial assistance to help pay for coverage, it is also trying to determine certain factors about the individual circumstances to see if they are eligible for those. The good news is that for many people, the information that they provide on the application will be sufficient to make an eligibility determination. For other people, they may need to provide some proof of their circumstances, oftentimes some different documents, could be something like a birth certificate or pay stubs, all information that we'll be covering during this presentation. So in our presentation, we will cover both how kind of the application is set up so that it can make these kind of eligibility determinations using data matching to the extent possible, as well as steps that people may have to take if their circumstances can't be verified electronically through data matching. So just as a quick overview, something that we're going to be utilizing, a term that we use a lot is DMI, data matching issue. And when we talk about data matching issues, we are generally, it's what is occurring when the electronic data sources aren't sufficient to be able to kind of corroborate or substantiate or verify the information that an applicant has put into the application. Next slide. So when a person completes the application, they're testing that they are providing truthful and accurate information. This is important, right? They're told you must provide truthful and accurate information, and they're told, again, when they're signing the application at the end, they're reminded of this. So a lot of the information is accepted without any need to do anything further to verify the information that an applicant has put into the application. So for example, in healthcare.gov, the application that a lot of you utilize, right, to get people enrolled in the marketplace, that application is set up so that it will accept the person's information about where they live, the address that they're providing, as sufficient to determine state of residence, which state of residence, or living within the marketplace area is a eligibility factor. So other eligibility factors must be verified, such as citizenship. The application will seek to verify these factors through electronic data matching with a variety of trusted sources, such as trying to get information from the Social Security Administration or the IRS data files or the Department of Homeland Security data files. And in some cases, it's non-government entities such as the work number oftentimes is utilized. And when eligibility factors can't be verified through these electronic matches, applicants are requested to provide proof of their circumstances and additional information. Next slide. So a data matching, all of this, sharing of electronic information that happens behind the scenes is really fantastic when it works, and it works quite often. I will say that this is one of those circumstances when it doesn't work that you hear more about, right? Like you hear more about the things that don't work out well, the bad news, the more than we pay attention to when it does work. But in actuality, these data matches do their job, and a lot of people can have their circumstances verified, and then they don't have to provide any paper documents. But some people do, and there are issues that come up. And it is not because, it's not generally because a person has done something wrong, right? I mean, sometimes they make mistakes, right? That happens. And that could be a reason for a data matching issue. But also, this data sources and the data matching is not perfect either. So for a variety of reasons, sometimes the data matching is not going to be sufficient. So in some cases, the data is just simply not available through the data sources that are matched up against. So for example, an applicant maybe didn't file their taxes in the past couple of years. So there's no data that can be utilized when the computer is trying to seek an opportunity to verify income through records that are held by the IRS. Like if they haven't filed taxes, maybe they just started working. Maybe they just became an independent person. They used to be a tax dependent of their parent. So for a variety of reasons, they might not have data in the files. In some cases, an individual may have changed their immigration status, and maybe they went through a naturalization process to become a U.S. citizen, or maybe they, as I mentioned before, they just came into the workforce, right? So there's a variety of different reasons why their information just may not appear in these data sources. In some cases, the match just isn't quite precise enough. So what that means, what the term that we use is that it's not reasonably compatible, right? And that means that the information provided by the applicant doesn't match closely enough to what the applicant has indicated and stated in the application. And that could also happen for a variety of reasons. It could just be that the information that's being tapped into is old, right? It doesn't reflect things like a change in employment, or perhaps the household has changed. Maybe there's a new baby in the household and now the number of people is no longer the same. Or maybe there, was a tax dependent, that tax dependent's gone. There's a variety of things that could happen in a household. Next slide. That could result in a mismatch. So when a DMI happens, when a data matching issue happens, that triggers a set of actions, right? An eligibility determination notice should be provided to the applicant, and it should tell the applicant that more information is needed, and provides directions about how and to submit that information, and what would be good enough proof to complete this data matching issue. Generally, applicants can temporarily enroll in marketplace plans based off of their attestations provided, and in most cases, they can even receive their advanced premium tax credits based off of their attestations while this data matching issue is being kind of worked through. Consumers usually have between 90 or 95 days if the data matching issue is related to immigration or citizenship status. There's 95 days. And for all other eligibility factors, it's 90 days, because it would be too easy to just say 3 months for everybody. So it's just, those are the dates. Those are the number of days that people have to submit their documentation. Next slide. So what will happen, kind of what the experience is going to be for the person completing the application? They're going to first get a notice on screen when the application is submitted. So they're going to first see this, in red, right? That you have a data matching issue. And then they're going to get their eligibility determination notice, and there's going to be some information that says, there's your eligibility or your enrollment is temporary, and we'll provide some information about the next steps and what a person needs to do to resolve this data matching issue. Next slide. So then, that is not where it ends. They will continue to get additional requests for more information. There'll be some warning notices, and those notices will be sent, 90 days out, 60 days out, and 30 days before this data matching issue needs to be resolved, right? And if you think about it, this can sometimes be a little confusing for a person because maybe you're helping somebody enroll in the marketplace. And we all know, right? Like there's no time like the present because you may never see this person again. So when that person's there, you're going to do everything you can to try to resolve this data matching issue right then and there, right? Like let's say, and not that everybody always, comes with their birth certificate and their, driver's license and, other, or here's my pay stubs or whatever. But in general, you want to do everything you can to get this resolved as quickly as possible. Let's say a person is filling out the application and immediately, sends in their information. The notice, this warning notice has already been triggered, right? It's that first warning notice, it's going to still come. So even if they have submitted that first piece of documentation, it might mean that they still get a warning, the first warning notice. Ideally, we would think that the next notice wouldn't come through, but it might. And, to the extent that you do have somebody leaving, you want to make sure that that person, without submitting all the documents needed, you want to make sure that they understand that information's coming. You can tell them ahead of time that they should expect to get some warning notices. You should tell them to come back if they need help in figuring this out and all of those things, and to be really on the lookout for different messages that will be coming. Other ways that the marketplace reminds people that they they have to submit documents will include emails, text messages. They will even get phone calls from the marketplace. And some cases, people might submit one piece of document or a piece of documentation, but it's not going to be sufficient to clear the data matching issue. They'll also get a paper notice in the mail if that's the case, and they might also get a telephone call. Next slide. So I'm going to go through what the verification process for citizenship and immigration looks like in the application. And when we show you, these notices, examples of notices, or some of the questions, we are referring to healthcare.gov here. But in general, Medicaid applications and marketplace applications from other states, they will still follow the general process on the verification side. The way that it might look might be different. Maybe the questions might be worded slightly differently. The sequence might be different. Next slide. So how the marketplace verifies citizenship. So the person is first going to be, the applicant may provide a social security number if they have a social security number, right? And in the case of a US citizen, they normally will have a social security number unless they're like a newborn or maybe have, a religious reason why, or there might be very odd cases. But generally people will provide a social security number in the application. And they will say that they are an application. They will be provided an opportunity to attest to US citizenship, and they'll say yes. And then healthcare.gov uses information that's been provided in the application, like name and address and other information, other important factors, and they're going to share this information with the Social Security Administration. The Social Security Administration is going to say yes or no that they can substantiate the claim of citizenship. And if the Social Security Administration can't substantiate citizenship, the applicant is usually asked another question. And that question is if they are a naturalized or derived citizen. And if so, they're going to be asked to provide information that is generally found on their naturalization certificate or certificate of citizenship. And then healthcare.gov is going to try and verify that information through records that are held by the Department of Homeland Security SAVE system. So that's generally what's happening. Oftentimes, there are some people who have gone through this naturalization process to become US citizens that can be verified electronically, but a lot of people are going to hit a stumbling block if that's the case for them, because the Social Security Administration isn't always going to know that they have changed their immigration status. Oftentimes people had one immigration status, like they were a lawful permanent resident, for example, when they got their Social Security number, and then the Social Security Administration is clear, it's really not set up to be like, hey, come back now and verify you when you change your citizenship. So that's one of those kind of data constraints that I talked about beforehand that could happen. Next slide. So so sometimes there might be other reasons why this data matching doesn't work. It could be that the person didn't provide a Social Security number at all, or the number that provided was typed in incorrectly. That happens. That happened to me once before. Yeah, not fun when your employer to be tells you, you know what, we weren't able to verify your citizenship. It can happen. So you can type in the wrong number. Sometimes there are other factors, right? Like I mentioned beforehand, sometimes people have changed their immigration status, or sometimes people, there are some limitations in the data sources. So some people were born outside of the US, and even if they got their citizenship like right away, because maybe their parents are US citizens, but they were living abroad, in some cases, if they were living abroad, the Social Security Administration, when they were born, they're not, the Social Security Administration just simply isn't going to be able to corroborate or substantiate the claim of citizenship. It's just outside of the data that the Social Security Administration holds. And then some consumers may have changed their name or their information, like maybe they got married and didn't, change their information. So there's all sorts of different things that could happen. In some cases, and I have seen this happen before, people make the wrong attestation. And that's really important to spot if that happens. If somebody, because the questions are not always like artfully written that are so perfectly clear, and people could get confused, or they just, for whatever reason, they just get confused and they say, yes, I'm a citizen, and then they could submit all the documents in the world and it's never going to match up, because the attestation isn't going to match with the documents aren't going to substantiate the claim that was made, right? So so you want to check all of those kinds of things. Next slide. And when there's a data matching issue and somebody is attested to US citizenship, these documents that are here on this slide, like a US passport or certificate of citizenship, these kinds of documents that are here, these on their own can substantiate, can verify someone's US citizenship. It can satisfy the whole thing. That's the only document that would be needed if one of these is available. Next slide. But sometimes people don't have those documents, right? Like not everybody has a passport, right? If that's the case, then you're going to have to, it's basically a two-step process that you're trying to achieve. You're both trying to have a document that will prove citizenship and a document that is seeking to prove identity. And both of those together are what is going to satisfy a citizenship related data matching issue. So you would have to submit one document from the left side of this table for citizenship purposes, and then one document from the right side of this table that is seeking to kind of match not only the citizenship, but also something that proves their identity. And you're going to hear me talk about other identity later on in the presentation. Let's keep this just the citizenship piece. Don't that other part is going to be separate from, it's a separate thing that we're trying to do. Here we're trying to really overcome a data matching issue related to citizenship. Next slide. So how does the marketplace application verify immigration status? So if the person has said, nope, I'm not a US citizen, we saw that the other question earlier, then the person's going to be asked if they have an eligible immigration status. And you see that A lot of people aren't really going to know what that means. So they might click on that blue language, which links them to a document on healthcare.gov that will provide a list of all these different statuses. And if a person is one of those statuses, then they can say yes, right? And then they're going to be asked a series of other questions, including like, what document do you have, right? Because they're going to be seeking from the applicant different numbers depending on what kind of document that person has that they use to verify their immigration status. So it is a little bit confusing. So it's kind of like, first we want to know, do you have an eligible immigration status? Second, if you do, we're going to ask you specifically what kind of document you have that we can use. And then when you provide that, the relevant numbers that are asked, the marketplace is going to try to verify the person's status through a data match with the Department of Homeland Security's SAVE system. Next slide. So there's a lot of reasons for data matching issues. Like we talked about before, it could be a combination of things. Maybe the wrong numbers are provided. And in a minute, I'm going to talk to you a little bit about the numbers that are requested. This is actually a big one that could potentially come up and really trip people up on the application when it comes to verifying immigration status, because it's super not clear oftentimes to the person which numbers they need to be providing, right? So that could be a big reason. There could be name changes, all the same kinds of things from beforehand. And then there's certainly, there's also just certain immigrants, because the kind of status that they have, that simply just, the information is just simply not in the SAVE system, or there's a big delay before it ever can appear in the SAVE system. So there are certain immigration statuses that people might have that will always be challenging to get verified electronically through this data matching. Next slide. So the kinds of documents the numbers that are going to be requested, we kind of list them here by document type, and then what number the application is going to be asking the consumer to provide, so you see, like for the permanent resident card, they're going to be asking for the registration number, the card number, and then you will be looking at that document. And oftentimes people do have their document, unlike like I don't normally carry around my birth certificate as a US citizen, right? But if I were to go and talk to like my family member, a lot of my family members are lawful permanent residents, and they are going to have their permanent resident card on them. So in many cases, you're going to be able to help them immediately to upload a document if there is a data matching issue. And you're going to be able to help them to try and figure out which numbers to provide into the application, because they oftentimes, not always, but they oftentimes will have like their employment authorization card or their permanent resident card. Just a lot of times people hold those on their person. Next slide. And here's just some more documents that could people might have, and there might be other documents that aren't even listed here, and there will be an opportunity in the application to select other documents. Next slide. So I give you an example here of why it's a little bit challenging to try to walk somebody through which numbers they're going to be extracting from their document and then putting into the application. But we have a whole resource that will be available to you, that is available right now on the Beyond the Basics website. So I'm definitely not going to bore you by reading through all of these slides, but I do want you to kind of come away with a couple of things. Oftentimes we talk about, for example, there's a lot of confusion that happens, right? Like oftentimes you might say, can I see do you have a permanent resident card, right? And a person might be like, what? You mean my green card, right? Like they might, or you might say green card, but then they might not even know what that is. And you might have to say like your permanent resident card, or do you have a document that you use to prove your immigration status that we can look at because we have to get some numbers. Like that might be the better way of doing it, because all sorts of names, people might refer to as these documents, and it's hard to know what they are. And, we sometimes laugh because for many years, the green card was, the name, the vernacular. Well, there's lots of different iterations of green cards, and some of them are very much not green. So just be on the lookout that, not all is what it might seem, right? In terms of the colorful language that we use. That may have, some historical background, but it's not relevant at all today. You will also notice that even though the application will ask for certain things like quote unquote, an alien registration number might be something that's requested, but on the actual card itself, it might not say those words. It might say USCIS number. And so there's a mismatch, right? And it's going to be confusing. And I wish I could tell you that it wasn't, but it is. So what we did was we created a document that you can use. And healthcare.gov has a very similar document too on their website that can help you walk through different kinds of documents so that you can kind of decipher which number is likely to be the right one. Next slide. So if the status, so if an applicant is unable to prove their citizenship or immigration status, like I mentioned before, they have 95 days where they have this DMI window where if they don't provide sufficient proof to prove their status, their coverage will be terminated. And when I say coverage terminated, I mean coverage terminated, not just their PTCs, not just the health. They will actually be disenrolled because it is a requirement to even enroll at full cost out of your pocket in the marketplace if you do not have a status that makes you eligible to enroll in the marketplace. Okay, so that's important for you to know. If a person submits documents after coverage has been terminated, they will have the opportunity to re-enroll under a special enrollment period. And the SEP will begin the day of the DMI was resolved, and they'll have 60 days from that date to re-enroll in coverage. So they have this opportunity. They can choose to have coverage begin actually even retroactively or prospectively, depending on what meets their particular needs. Next slide. So I'm going to go through an example, but I'm going to try and go through it really quickly because I am running out of time. So we have Roberto and Monica, and they're a married couple. They have 2 kids, Miguel and Elena. And we're going to say that Monica was born in Germany, outside of the country, but she was a derived citizen, right? I talked a little bit about this earlier. So she's one of those cases that she was born a US citizen just outside of the country. So we already know that could be a tricky situation, right? Roberto has been a lawful permanent resident for 7 years, and Miguel and Elena were born in the US. Next slide. So all the family members provide their social security numbers on the application, and Monica, Miguel, and Elena all attest to being US citizens. And Monica is one of the people who is asked if she's a naturalized or derived citizen, and she answers yes. And then Monica doesn't have her certificate of citizenship, so she skips that question that's asking for the documents, and you can skip that question. But if you have the number, then it's really good if you provide it, because you might be able to get verified electronically that way. Roberto attests to having an eligible immigration status, and he provides his A number, but he does not provide his card number. So he provides one piece of the information that's provided, but he doesn't provide the other. Maybe he couldn't decipher which number it was on the card. That could potentially happen. Next slide. So we have Monica. Let's see if the data matching worked, right? So we talked about Monica's situation, and we're going to say the Social Security Administration was not able to verify her citizenship because she's one of these cases that was born outside of the US, and simply that information is not in the SSA records. And the next step in the whole process would be that if she was able to provide that second piece of data, the number from her certificate of citizenship, they would try and match it against the Department of Homeland Security's SAFE system, but she didn't have that readily available. And there was no match, right? Roberto, we're going to say, well, one, he never claimed citizenship, right? Because he's not. So there was no match against the Social Security Administration about his citizenship. So they went directly to a SAVE match, right? And he didn't provide sufficient information, we're going to say, in this case. So there was no match made. We got Miguel and Elena, the kids, and they claimed citizenship. They provided social security numbers. Boom, it worked fantastic. As I mentioned, it works fantastically well for a lot of people, and kids are oftentimes one of those examples. So next slide, please. So now we have the eligibility results, right? Monica and Roberto are instructed to provide documents to prove their status within 95 days, and all family members are approved to buy marketplace plans and awarded advanced premium tax credits. And we, will see that each individual within the marketplace application will be provided information about their eligibility for whatever program that they're applying for, and then the next steps, right? So we have to assume that information then would be provided for both Monica and Roberto, that they need to provide more documentation to prove their status. Next slide. So Monica and Roberto get warning notices. In addition, they've already gotten the EDN. They already got that, pop up, hey, you have a DMI, you need to provide information. They got to pop up at the time that they submitted the application. They got in their eligibility determination notice information, and then they get the warning notices that provides a little bit more information about what people need to provide to sufficiently document their immigration status. In this case, Monica sent in her consular report of birth abroad. But remember how I said that with the exception of a few things like your passport and some other things, a lot of documents for US citizenship, you need to provide both something that proves your citizenship and your identity, right? In this case, we're going to say that Monica doesn't have that second piece of documentation to prove her identity. So she only submits what she can, and she submits her consular report of birth abroad, right? That proves citizenship. Roberto sends in his foreign passport, which in some cases may be used to prove lawful permanent resident status, but in his case, it's not necessary. It's not sufficient, right? Information. So what happens? Next slide. So Roberto then gets another warning, right? So then he sends in a copy of his green card, his lawful permanent resident document, and Monica doesn't have any other documentation, right? So she doesn't submit anything else. So what happens next? Roberto we clear the path for him with the green card, so he moves on, and that clears up the DMI, and Monica still has his DMI. She will later get a data matching expiration notice explaining that her coverage will end because she did not provide proof of her citizenship, sufficient proof to verify her citizenship, which again, 2 documents would be needed. Next slide. So what happens next for Monica? So Monica can still regain her coverage if she sends in necessary documents. So after resolving the data matching issue, she can enroll in a marketplace plan. Again, she could do it prospectively or she could do it retroactively, right? So May 1st, Monica is no longer covered. She loses coverage. Her coverage expires. She obtains a state ID with her picture on it, and she uploads a copy to healthcare.gov on May 3rd. She spent a lot of time at the DMV apparently, right? Because that's pretty fast. Let's hope that people can do that quickly, but it's not always that easy. Monica's DMI is resolved on May 14th because now she has the combination of something that proves her citizenship and something that proves her identity. And now she's eligible for a special enrollment period, and she can have coverage in APTC going forward. The SEP is available for 60 days to enroll in this coverage. She can also have she can have retroactive coverage that begins when she lost coverage if she needs to, if she wants to. She would of course have to also pay for that, the coverage in the past, as needed. So next slide. Now I'm going to turn it over to Tara while I go get some tea, and I'll come back to you in a little while.
Thank you, Shelby. So now we're going to talk about verification of household income. Next slide, please. So as you know, an applicant attests to their projected income for the next year, so for 2022. Applicants have to list the source of income and the amount of income for everyone in the household, even if only some family members are applying for coverage. And attestations on the application are usually matched with the IRS tax return data in the federal data hub. The most recent tax return data will be for the 2020 tax year, which presents some complications that we'll address later. Next slide. So as Shelby touched on earlier, there are many reasons that data matching might not verify income. And again, some of these may be significantly more true because of COVID. So first, people could have a change in their job or in their hours of employment. For instance, if someone worked retail, maybe they worked more or fewer hours than they did. Maybe they will plan to work more or few hours in 2022 than they did in 2020. A receipt of unemployment income, a change in household like divorce, separation, marriage, retirement, losing wages and gaining retirement or Social Security benefits. Freelance and self-employment income is definitely variable by year. Also, there's one-time income like an IRA withdrawal or a death benefit. And of course, there are some people who have no tax data available because they didn't file taxes in prior years. Next slide, please. So here are the general rules. The income projected in the application is usually accepted if the attestation is higher than the income in the data hub, regardless of the income difference. So breaking that down, the attestation has to be higher. And if you think about why that might be the case, it's because they don't want you to take more APTC upfront than you were entitled to. And so if you say that your income is higher than in the data hub, then you're taking less APTC. And they don't mind if you take less, they just don't want you to take more. Or the attestation can be lower, but not low enough to trigger the threshold. And the threshold is tricky, it's a little complicated. It's the projected, the threshold is when the projected income is 25% and $6,000 lower than the data available in the hub. So again, the attestation can be lower, but it can't be substantially lower. And that substantially lower is the 25% and $6,000 lower. So previously, there was a DMI that was triggered when an attestation was above the poverty line, but the data sources suggested that income was lower. And this is no longer going to happen. There was a court case that required CMS to change that provision. But when is a DMI actually triggered? It's triggered when an applicant, or what happens when it's triggered? An applicant is awarded subsidies based on their attestation, but they have to provide documents to verify their household income, either because there's no income in the data hub or because they failed that threshold test. The attestation is 25% and $6,000 lower than the data available in the hub. Next slide, please. There are a lot of documents that can be used to verify income, and I'm not going to read them out to you. It's just about every kind of tax document that you can imagine, different wage statements, for instance, from unemployment, retirement and pension documents, pay stubs, lots of different documents. And those are listed here, but they're also listed, there's a footnote at the bottom about a resource that healthcare.gov has that's very helpful in this. Next slide. So as I mentioned, the marketplace does have some good resources on how to resolve income DMIs. And they have an example of example documentation and also a worksheet to help collect the documents that are needed to verify household income. So you can see examples there. They have as sort of a general, your household's expected income, but then they have even a self-employment chart to help people who are less sure about their income, try to break it down in a few different ways. Next slide. So what happens if documents aren't available? So we saw that whole list of documents, but they're not always easy to obtain. So when proof of income isn't available, a signed statement can be accepted. And I can't emphasize this enough. This doesn't have to be your last resort. A signed statement is absolutely fine. It's a great way to resolve an income DMI. The statement needs to include household income information and an explanation for the income projection. So you can see here that Kayla has some basic information about her application. It's really important to include the application ID. We didn't fudge one there, but it's really important to put that in, to put in your phone number and the date, and a very simple explanation of your income projection. Next slide, please. So let's look at an example of household income and what happens when that income goes down. Jalen is self-employed and his wife, Mia, works part-time at a bookstore. On the family's 2020 tax return, which again is the basis for the income verification because it's the most recent tax return the IRS has, Jalen reported self-employment income of $50,000 and Mia had earned income of $25,000 at her job. So that was a total of $75,000 on their 2020 tax return. But Jalen lost his best customer in 2021, and so his income will be less for 2022. Because of the loss of income, they expect to withdraw a little bit of money from their IRA. So when they apply for 2022 coverage, the family is going to attest to their income of $55,000. And you can see why that is because of the combination of Jalen and Mia's income plus their $5,000 from the retirement account. The attestation is more than 25% and $6,000 below what their 2020 tax return shows. And so it triggers a DMI. Next slide, please. So here's what's going to happen. So we know the family attested to projected annual income of $55,000. The marketplace will provide APTC based on that attestation and gives the family 90 days to submit documentation of their income. And as Shelby talked about, that would be in the eligibility determination notice, or EDN, that they get after they submit their application. If they fail to submit documentation, the marketplace isn't going to automatically cut off their coverage, but it is going to base their APTC on their 2020 tax return data. And so in this case, their APTC would be lower because their income in 2020 was higher. Next slide. So what can the family do in this 90 days to resolve this? First of all, they can submit evidence of their income. Jalen can submit a ledger that shows his projected business income and expenses. Mia can submit her most recent pay stub, and they can just explain the IRA withdrawal. Or, as I mentioned before, they can submit a statement that just explains their source of income without having to submit pay stubs and other sort of formal documentation. And so we can see that if we just do the math and they write a short explanation along with this kind of explanation of their income, they can hopefully have this DMI resolved. Now, one thing that I want to point out here is that even though Jalen was the one who had the big difference in income and Mia's income stayed the same at $25,000 a year, they still need to justify the entire household income. So it's easy to get wrapped up in the more complicated Jalen situation because you know that he had the big discrepancy, and so you feel like you need to resolve him. But actually, if you just try to resolve him, and submit that, that's not going to be enough, because then you've only justified income of $25,000 instead of $55,000. So you have to go through all of the income sources for the household. Next slide. If the DMI if the income DMI is not resolved in 90 days, the APTC is going to be changed based on the information in the hub. And if there's no information available in the hub, the APTC will be terminated. And even though the APTC is terminated, the enrollee is going to remain enrolled, which is good and bad. It's good because they'll continue to have coverage, but it's maybe bad because they're responsible for the higher share or the entire premium. And if someone has set up an automatic withdrawal, for instance, that new higher premium amount may be withdrawn from the consumer's bank account. And if the enrollee doesn't pay the full premium, then a grace period begins, which is the subject of another webinar. But a helpful tip is that a consumer can actually request additional time beyond the 90 days by calling the Marketplace call center, and by demonstrating that they've made a good faith attempt to obtain the required documents during that time. So, Mia could say she was having trouble getting verification from her employer, or maybe Jalen could say that he didn't have all the information that he needed. Maybe he didn't have a contract signed from a vendor that he's going to use in 2022. So there are reasons that you can give, but again, I'll say it multiple times, that written explanation can get people out of a lot of trouble of trying to track down all of these documents that are needed. It just needs to be a clear explanation of income. Next slide, please. A person can resolve the DMI and restore the APTC by submitting documentation. And once even though that 90 days has expired, if they submit documentation, they can get that APTC back. They can also, if they realize that their application was wrong, they can correct their application and change the projection. And if that aligns with the data in the hub, then they will be able to restore their APTC. They can also file an appeal. If an appeal is successful, they can get retroactive APTC. If the person doesn't appeal, or if the appeal is unsuccessful, then they can get PTC for the gap months on their tax return. So they still have an opportunity at the end of the year to say, hey, after all, I was eligible for this PTC during the year. But for a lot of people, that doesn't help so much because they need the help during the year and not just after the year on their tax return. Next slide. So one more example here. We have John, and John fails to resolve his DMI. He's never filed taxes before. He attests to an annual projected income of $22,000, but he doesn't have any tax information available in the hub to verify his projection. And on top of that, he moved shortly after he enrolled. So he never got any of these 90, 60, 30-day notices to resolve his inconsistency. So his APTC and CSR were terminated after that 90 days. Now, John has some options. John can submit his documents now. If he remained covered and verifies his income, he can restore his APTC. So he has to have been paying his premium and submit his documentation. And if all of that works out, then he can get his APTC back going forward. John can also appeal. If he lost his coverage, he will need to appeal to re-enroll in coverage. So unlike the immigration citizenship DMI, there is no special enrollment period if John loses coverage because of his loss of APTC. Instead, he would need to go through the appeals route. So this is pretty straightforward though. He just submits the information that was requested to resolve the DMI. He'll be determined eligible. And when his appeal is successful, he can get APTC and CSR either retroactively or prospectively. John can also stay in his plan and pay the full premium. If he stays in the plan and pays the premium, like I said before, he can get the PTC on his tax return for all months he was eligible. But if he fails to pay the premium, or if his coverage lapses, then he may need to wait for the next open enrollment period. Now, John, with an income of $22,000, maybe he doesn't have the money to pay the full premium and then just wait until he gets the PTC on his tax return. So that's not the best option to rely on for a lot of people. Next slide. So we're going to do a quick tour of verification of other minimum essential coverage. Next slide, please. So there's a different kind of DMI, which we don't see quite as often, which is when there's an electronic match with Medicaid, with a Medicaid agency, Medicare, or the Office of Personnel Management, which is the federal government workers. And that electronic match might show that the applicant is enrolled in or eligible for other MEC, minimum essential coverage. If that's true, then they'll have to prove that they are not eligible and or not enrolled in other MEC. Now, it's really difficult to prove a negative. So people who encounter this can really have some trouble. The consumer can enroll in coverage with APTC based on their attestation, but they're going to need to submit these documents to prove that they're not eligible for or enrolled in coverage. And some of the documents they suggest would be a letter from an insurer showing that your coverage was terminated, maybe a termination notice for Medicaid or CHIP, or some other kind of proof. But again, as I said, it's really hard to prove a negative. And so that's a tough one to resolve. And if not resolved in 90 days, the consumer is going to lose APTC. But again, they will retain their marketplace coverage. And so if they lose APTC and they retain their coverage, they're going to have to find a way to pay their premiums. Otherwise, they're going to go into a grace period, and eventually their coverage will be terminated if they fail to pay their premiums. Next slide. There's also something called periodic data matching. And this is something that takes place during the coverage year, not at the start of the coverage year. And the marketplace periodically checks enrollment in Medicaid, CHIP, and Medicare. If a person is enrolled in marketplace coverage with APTC, but they're also enrolled in public coverage, they might receive one of these PDM notices. And if so, they have 30 days to respond. The Medicaid CHIP PDM notice asks an enrollee to, if they're actually enrolled in Medicaid or CHIP, to end their marketplace coverage. Or if they're not enrolled, they need to update their marketplace application to basically cycle through the application again and resolve the PDM that way. But if the consumer does nothing, so maybe the notice is confusing and the consumer doesn't do anything, then the consumer is going to be billed for the full premium because APTC will end. There's also a Medicare PDM, and if that's the case, the marketplace will terminate APTC, but again, leave the marketplace plan in effect at full cost, or they'll terminate both the plan and the APTC if the person elected to do so on their application. So on the application, they're asked a question about this. And if they elect to terminate when they become Medicare eligible, then the plan will terminate as well. If the plan is terminated, it's terminated for everyone, not just the Medicare beneficiary. So other members of the family will get an SEP to re-enroll in coverage. Next slide. And so Shelby is going to give us a very quick treatment of tips to prevent and resolve DMIs.
I will indeed. And a lot of these tips we've already covered. So I'm going to fly through these. Next slide. So as we've talked about beforehand, it's really important that you answer as many kind of questions as possible, and that you kind of double check things like, did I type in the birth date correctly or the social security number correctly? And all of those document numbers are super tricky, but you're going to really want to pay close attention to it. You want to really look at those resources that we pointed to help you figure out which are the right numbers to provide in here. And we provided a few other tips on this document as well. Next slide. And then we also provide kind of some best practices in terms of when there is a DMI and you want to upload documents. There's some things to know about how to save the documents, what kinds of document types you want to, just instructions that healthcare.gov has shared to indicate, how best to submit those documents. Next slide, please. I'm going to talk a little bit about identity proofing. Like I mentioned beforehand, in the next slide, you'll see that identity proofing is different than what we talked about beforehand for citizenship and status. When in citizenship status, you want to both verify identity as well as citizenship for many people, depending on what document they have. There's a whole other step that happens in the application that is not an eligibility requirement, and this is oftentimes referred to as identity proofing. And this happens really early on in the application. And basically what the application is trying to do is to make sure that you are who you say you are. And it's really just asking for one person in the household to get to the person who is actually submitting the application. They are going to have to be identity proofed in one way or the other in order to have an online account that can be utilized for a variety of things, right? Like having an online account allows you to hit that submit button at the end of the application, which you want to do, right? If you can. It allows you to select the plan online. It allows you to report changes later on, in your application electronically without having to call the call center. So it's great if you are able to get an account on healthcare.gov and or your state that has been identity proofed for a variety of reasons. Is just much more helpful to be able to operate within an online environment. Next slide. So what will happen is that when you're completing the healthcare.gov application, healthcare.gov is going to utilize information. It's going to ask you for some information. You being the person, in the household, one person in the household is going to put in their information. And healthcare.gov is going to work with a credit bureau agency type of organization that's going to utilize information that's available in credit history to try and get some information about you, like, did you own a Honda Civic in 1996 or whatever, right? All those kinds of questions that we've all probably seen when we've gotten new credit cards or when we've tried to open up a new bank account, and all of those kinds of things. They're going to try and ask a bunch of those questions. Now, not everybody has a lot of credit history, and the application just may simply not be able to generate those questions for some people. So that might happen, right? And other people, they might just answer it incorrectly. There's all sorts of mistakes that happen in the credit in credit history. So there could be a variety of reasons why you might not make it through this online step. So some people have to go through this next stage, which is telephonic identity proofing. So they will be instructed to call Experian to complete identity proofing over the telephone. And if they are successful, at that stage, then they're going to be provided a unique reference code, and they're going to be able to then move on back onto the online application. Other people are not going to be able to be helped through this telephonic process, and they will have to, if they eventually want to have an account that they can access online, that they can utilize to actually submit the application on healthcare.gov, to actually be able to make changes later, to be able to select the plan, those functions that are pretty helpful, they're going to have to provide some proof, some evidence of their identity to prove who they are. Next slide. So what would that proof look like? Well, you know what? It looks a lot like that other list I showed you beforehand, right? So there's a bunch of different documents that can be utilized that will prove identity, and those can be submitted on healthcare.gov. Next slide. So healthcare.gov, the way that this would work is that basically the person is going to be given 2 different attempts to complete identity proofing process. And if both of those attempts are unsuccessful, they're going to see a screen that looks a lot like this. And then they're going to be able to upload documents immediately if they are able to, if they're available, and it would be great if they could, right? I would recommend, because this doesn't mean that their identity is going to be proven instantaneously, even if, let's say that they do have the documents there. Sometimes people have to come back and do it afterwards, right? They don't have the documents. I would still highly recommend that when you're working with somebody, they run into an identity proofing issue, I would still work towards completing as much of the application as you can online, because generally you're not stopped until the very kind of close to the end of the application where you'd have to submit the application. And at that point in time, when you get blocked, you will, that's when you will, working with the person that's in this situation, would call the marketplace call center, and then they would finish and submit the application, because they can submit it through the call center. After the call center pushes that application through, that's oftentimes the terminology that's utilized. They push through the application. Then you can log back into the account and complete the enrollment process, which is much easier than trying to select a plan with the call center operator trying to read all those plans to you over the telephone. So that is very helpful. Next slide. And we have some resources here, and then I'm going to turn it over to Ina to finish us off. Thanks, everybody.
Thank you so much, Shelby and Tara, and thank you everyone for joining us today. As a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website. The next part of this webinar, series, which will cover the ins and outs of how health insurance works, is scheduled for this Thursday, September 30th at 1 p.m. Eastern, 10 a.m. Pacific. You can register for upcoming webinars on the Beyond the Basics website under upcoming webinars. If you have questions or need assistance, please email us at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again for joining us today.